I had to get my foot amputated on the fact that I had diabetes. Poison was in my blood, so they had to do some blood transfusions. At first they cut off a couple of toes, then they cut off my foot. Then they said we gotta go almost knee high for another surgery.
That's crazy. So if you don't know who that is, that's LeVar Ball. And I talk to my clients that have diabetes about how dangerous it is to have diabetes. A lot of the times, diabetes runs in our families, or so we say, right? And so we think because we've seen our parents have it or grandparents have it, it's just normal and it's okay. But I know personally in my family, I've had people get their foot amputated because they had diabetes. Now, why does this happen? It doesn't just happen just because you have diabetes, right? It happens because when people are diabetic, their blood vessels can get damaged. And so what that causes is what's called diabetic neuropathy. And so basically, you can like get numb, right? Especially in your lower extremities and your feet, you'll get numb. So what happens is people get a cut on their foot. If you stepped on a nail right now, you would know. You would feel like, it hurts, right? For them, they don't feel it. So what happens is a small cut, it starts to get infected a little bit. It might turn into an ulcer. And then the infection can get into the blood. And then once it's in your blood, and this is happening, like they don't know it's happening because they can't feel it. So eventually it gets so infected that you have to get an amputation to save the rest of your body. So this is why it's so important to take your health condition seriously. Diabetes, high blood pressure, you name it, because it can lead to things that can be life-changing in a negative way. And some of these things you can't come back from. One of the easiest ways to reduce your risk of diabetes, if you're pre-diabetic or in the diabetic range, is to reduce 10% of your body weight, right? Especially for someone that's largely overweight and you want to get control of your blood sugar levels, right? So reducing eating a lot of, simple carbs is going to help that as well. Focusing on high protein diets, high fiber, getting active, walking, 2 miles a day keeps the belly fat away. That's my motto. Weight training 3 times a week. These things are going to help you to live a healthier life and get away from diabetes. My name's Jeremiah. I coach professional and executive women for the past decade, helping them navigate things like diabetes, high blood pressure, hormonal imbalances like PCOS, or navigating menopause so you can lose 50 to 100 pounds in a year or less. Follow me for more fact-based health and fitness advice.